All of the following initiatives have been introduced recently to improve contraceptive coverage in India, except A. Antara, introduced under National Family Planning Program. B. Norplant is made available at primary health center. C. Syncroman is available free of cost. D. Asha are delivering contraceptives at doorstep. Among the given options, Norplant has not been recently introduced to improve contraceptive coverage in India. Norplant is a long-acting, reversible birth control method that involves the surgical implantation of capsules or rods under the skin. However, due to certain side effects and other issues, Norplant hasn't been made broadly available at primary health centers in India. On the other hand, initiatives like Anthara, providing Syncroman free of cost, and Ashas, delivering contraceptives at the doorstep, are recent efforts to enhance contraceptive coverage in the country. Syncroman is available free of cost, that is also correct. What is not correct is Norplant is made available at primary health center. It is not widely available because of certain side effects, and also it is not new. It is a old one only. So the correct answer is B.